Welcome dear student in my class. That is the class name is Determinant of Quality of Life. Name Lifestyle Diseases. Discuss in detail. Content of the life is this module is Introduction to Lifestyle Diseases, Types of Lifestyle Diseases, the role of lifestyle choices in preventing lifestyle diseases, the public health impact of lifestyle diseases, prevention and management of lifestyle diseases, key takeaway and learning outcome. Learning objective of this module is student will explore the relationship between lifestyle choices and the development of chronic diseases, the impact of these diseases on public health and strategies for prevention and management. By the end of the module, student will have a deep understanding of the major lifestyle diseases, the scientific basis for their occurrence and how they can be managed at individual and societal level, and define lifestyle diseases and recognize common types such as cardiovascular diseases, diabetes, obesity, and certain cancers. Identify key risk factors for lifestyle diseases including poor diet, physical inactivity, smoking, alcohol use, and stress. Understand the impact of lifestyle diseases on individual health, public health system, and global economics. Learn preventive and management strategies to reduce the risk of lifestyle diseases, including healthy eating, regular exercise, and stress management. Apply knowledge to real-world scenario, proposing solution to prevent and manage lifestyle diseases in different communities. What is the lifestyle diseases as discussed in previous classes, that is the obesity, metabolic syndrome, chronic lung disease, some cancer, diabetes, stroke, and heart disease. Now we discuss definition of the lifestyle diseases. These are the disease primarily caused by unhealthy lifestyle choices, including poor diet as fast food or lack of protein and lack of physical activity, smoking, alcohol consumptions, and high stress level. These conditions are often preventable and are typically linked to the modern way of living. These diseases are chronic in nature. Lifestyle diseases are often chronic and long-term, and they tend to develop gradually over time due to repeated exposure of risk factor. Key characteristics of the lifestyle diseases. Now discuss what is the chronicity. Most lifestyle diseases such as heart diseases, diabetes, and certain cancers are long-lasting, but some are preventable. With the high preventive measures, healthy lifestyle choices, many of these diseases can be prevented or their onset delayed. Impact on quality of life. These diseases often reduce life expectancy, quality of life, and contribute to disability in affected individuals. The rise of lifestyle diseases. Modern lifestyle factors, that is urbanization, sedentary behavior, unhealthy diet, high in processed food and low in fruits and vegetables, stress and increased use of technology contribute to rise of lifestyle diseases. Now, global burden. According to the World Health Organization (WHO), lifestyle diseases are responsible for a large proportion of global death and are a significant concern in both developed and developing countries. Now discuss about types of lifestyle diseases as discussed in earlier, that is cardiovascular diseases known as CVD. Cardiovascular diseases include a range of heart and blood vessels related conditions such as a coronary artery disease, heart attack, stroke, and hypertension. Prevention, regular exercise, balanced diet, stress management, avoiding tobacco and alcohol, regular health checkup. Impacts, as CVDs are one of the leading causes of death globally, significantly affecting public health. Risk factor of CVD: unhealthy diet, high in saturated fats, cholesterol, and sodium, physical inactivity and obesity, smoking and excessive alcohol consumptions, stress, and genetic predispositions. Next disease is type 2 diabetes mellitus. Type 2 diabetes is a chronic condition that affects the way the body metabolizes sugar, that is glucose. It is primarily influenced by lifestyle factors such as obesity and lack of physical activity. Prevention of this disease is maintaining a healthy weight, regular exercise, balanced diet rich in fiber, controlling blood sugar levels. Impact of this disease is complication from untreated diabetes, including kidney failures, blindness, and cardiovascular diseases. Risk factor is obesity and overweight, poor diet, excessive sugar and processed food, physical inactivity, and family history and age. Next disease is obesity. Obesity is characterized by excessive body fat, typically measured by body mass index, that is BMI, of 30 or above. Prevention from this disease is maintaining a healthy weight through proper diet, regular physical activity, and stress management. Impact of this disease, that is obesity, is a major risk factor for other lifestyle diseases like diabetes, heart disease, and certain cancers. Risk factor of obesity is poor eating habit, including overeating and high calorie diets, physical inactivity and sedentary behavior, genetics and emotional factors like stress and depression. Next one is cancer, that is certain types of cancer. Certain cancers such as colorectal, lung, and breast cancer have been linked to lifestyle factors, particularly diet, physical activity, and tobacco use. Prevention of these diseases is avoiding smoking, reducing alcohol consumption, regular physical activity, healthy diet, and regular screening. Impact of these diseases on bodies. Cancer is one of the leading causes of death globally, and certain lifestyle changes can help reduce the risk of developing some types of cancer. Risk factor of cancer is smoking and tobacco use, excessive alcohol consumption, poor diet, low in fruits and vegetables, high in processed foods, physical inactivity, and obesity. Chronic respiratory disease. Next one disease is COPD, asthma. Chronic obstructive pulmonary disease and asthma are long-term respiratory conditions often exacerbated by lifestyle choices like smoking and air pollution exposure. Prevention from this is smoking cessation, minimize exposure to pollutants, maintaining a healthy weight, and regular physical activity to improve lung health. Impact of these diseases is limit breathing capacity, leading a disability and early death in severe cases. Risk factor of COPD asthma is smoking and exposure to second-hand smoke, air pollution, including outdoor and indoor pollutants, lack of physical activities, and poor lung health. What is the role of lifestyle choices in preventing lifestyle diseases? Now, discuss in next slide. Increased risks for developing CVD and related consequences, invasive treatment and prescription drug side effects, and substantial direct and indirect costs, increased risk for premature mortality, and decreased quality of life in current behavior. Decreased risk for developing CVD and other associated benefit is decreased risk for developing other chronic diseases, enhanced physical function, and improved quality of life. The importance of diet in quality of life. Balanced diet. A healthy diet consisting the fruit, vegetable, whole grains, lean protein, and healthy fats is crucial for maintaining health and preventing lifestyle diseases. Nutrient-dense food, avoiding processed food, high sugar, and unhealthy fats help reduce the risk of obesity and cardiovascular diseases. Dietary recommendations: limit red meat, processed food, and sugar drink while focusing on fibers, antioxidants, and micronutrients. Physical activities for quality life, exercise, and health. Regular physical activity is a key factor in preventing and managing many lifestyle diseases, including obesity, diabetes, cardiovascular diseases, and certain cancer. Guideline for physical activity for beginners: at least 150 minutes of moderate intensify aerobic activity or 75 minutes of vigorous intensity activity per week. Muscle strengthening activities on 2 or more days per week. Benefits of these activities are: physical activity help regulate weight, lower blood pressures, improve cholesterol levels, and boost mental health. Stress management. Impact of stress, that is the chronic stress, is linked to several lifestyle diseases including cardiovascular diseases, diabetes, and mental health conditions. Stress reduction technique is meditation, yoga, mindfulness, adequate sleep, and regular relaxation can help manage stress effectively. That work-life balance. Creating a balanced lifestyle, including setting boundaries and time of self-care, is essential to in reducing stress. Next is smoking cessations and alcohol moderation for living quality of life. Smoking and disease. Smoking is a leading cause of cardiovascular diseases, chronic respiratory diseases, and cancer. Quitting smoking significantly reducing the risk of these diseases. Alcohol consumptions. Excessive alcohol intake is linked with liver diseases, certain cancers, and cardiovascular diseases. Moderate drinking or abstinence is recommended for better health outcome. Alcohol use is negative emotionally: depression, anxiety, anger, boredom, pain, sleep problem. Executive function disturbed, that is the decision making, cognitive control, and expectancy, self-efficacy. Craving, reward, seeking cue reactivity, subjective response, incentive salience, and social pressure, coping regulation. How? Social pressure, network support, that is social environment that promote the alcohol use, that is DBAR. Sleep hygiene. Importance of sleep. Poor sleep quality and insufficient sleep can contribute to obesity, diabetes, cardiovascular diseases, and mental health disorder. Healthy sleep habits, regular sleep patterns, reducing screen time before bed, and creating a restful sleep environment help improve sleep quality. What is the public health impact on lifestyle diseases? Epidemiology of lifestyle diseases. Prevalence. A discussion on increasing prevalence of lifestyle diseases globally, especially in low and middle income countries due to urbanization and changes in diet and activity level. Global health trend now is insight into global health data showing the increasing burden of lifestyle diseases on their economic and social impact on healthcare system. Economic cost of lifestyle diseases, healthcare cost and productivity loss. Healthcare cost, healthcare cost. Lifestyle diseases impose a significant economic burden on healthcare system due to long-term treatment costs, hospitalization, and medical intervention. Next is productivity loss. Is individuals suffering from chronic diseases often face reduced productivity and early retirement impacting the economy. Now, public health strategies as prevention program and policy initiative. Now, first we discuss about prevention program, that is government and healthcare organizations implement prevention programs focusing on education, lifestyle changes, and early intervention to combat lifestyle diseases. Policy initiative, public health policies such as regulating tobacco use, taxing sugary drink, and promoting physical activity in schools are the part of effort to reduce the prevalence of lifestyle diseases. Prevention and management of lifestyle diseases. Now discuss primary prevention strategies, education and awareness, promoting healthy lifestyle choices through media, campaign, community health program, and educational initiatives. Health screening, encouraging regular health checkups for early detection of risk factors like high blood pressures, high cholesterol, and prediabetes. Secondary prevention is managing risk factor, that intervention aimed at individuals at high risk for developing lifestyle diseases including lifestyle modification, medication, example, statin for high cholesterol, and regular monitoring of health condition. Tertiary prevention is chronic disease management is for individuals already affected by lifestyle diseases, managing the conditions through medications, therapy, rehabilitation, and ongoing health monitoring. Key takeaways of this module is lifestyle diseases are preventable through healthy lifestyle choices including diet, exercise, and management to live a quality of life. Public health initiatives are essential in raising awareness and promoting healthier behavior at both the individual and societal level. Early detection and proper management of lifestyle diseases can prevent severe complications and improve overall quality of life. Learning outcomes of this module is student will be able to identify and explain the major lifestyle diseases. Student will understand the risk factor and prevention strategies for lifestyle diseases. Student will be equipped with practical knowledge on how manage and prevent lifestyle diseases both individually and community setting. Thank you.